All right, let's jump right in. Today we're going to demystify some of the most common and sometimes complex childhood health conditions. We'll break down the signs, the treatment strategies, and maybe most importantly, the crucial role families play in all of this. Ready? Let's get started.
So here's our roadmap. We'll start at the very beginning, with the developing nervous system. Then we'll talk about conditions that affect sight and the body's structure. After that, we're going to dive into the bloodstream to see what happens when blood cells go awry. And we'll wrap it all up by focusing on what ties everything together, the support systems for children and their families.
So this is really the big question, isn't it? How do we even begin to understand and manage these complex illnesses in kids? Well, the answer really lies in a mix of deep medical understanding and proactive, compassionate family care. And we're about to see exactly what that looks like.
Okay, let's dive into our first section, the developing nervous system. We're talking about conditions that affect the very command center of a child's development, their brain and their spine.
First up is spina bifida. So what is it exactly? Well, it's a type of neural tube defect. You have to think way back to the first few weeks of pregnancy when the brain and spinal cord are first forming from this structure called the neural tube. With spina bifida, that tube just doesn't close all the way.
You know, a really great way to picture this is to think of the spine developing like a zipper on a jacket. Normally, it zips up nice and smooth, but with spina bifida, it's like the zipper gets snagged partway up, leaving a little opening. Now, spina bifida isn't just one thing, it's actually a spectrum. The mildest form is called occulta, where there's just a tiny gap in the spine you can't even see from the outside. Then you have meningeocele, where a little sac with fluid pushes through that gap. And the most severe form is myelomeningeocele. This is where the spinal cord itself is actually protruding into that sac, which often leads to nerve damage.
And this brings me to something that is absolutely critical to know. Kids with that most severe form, myelomeningeocele, go through a lot of surgeries and medical procedures. Because of that, they're exposed to latex products over and over again, which puts them at an extremely high risk for developing a serious, even life-threatening latex allergy.
Okay, next up is epilepsy. This is a condition where a child has recurrent seizures that start inside the brain. And while that diagnosis can sound really scary for a parent, it's important to know that it's one of the most common neurologic issues in childhood. For many kids, the outlook is actually very positive, and some even outgrow it completely.
Knowing what to do in that moment is absolutely vital. So let's walk through it. First, and I know it's hard, try to stay calm and just gently ease the child to the floor. Then immediately start timing the seizure. As soon as you can, roll them onto their side. This keeps their airway open. And this is so important. Do not try to hold them down or put anything in their mouth. You could cause a serious injury. And you need to call for help if the seizure goes on for more than 5 minutes, if it's their very first one, or if they seem to have trouble breathing.
All right, let's shift from the nervous system to our second section, from sight to structure. Here, we're going to look at conditions that affect how kids see the world and how their bodies are built. You've probably heard of lazy eye, right? Well, the medical term is amblyopia. And what's interesting is that it's not actually a problem with the eye itself. The eye is perfectly fine. The issue is with the connection between the eye and the brain. The brain just starts to favor one eye and ignore the signals from the other one. And if you don't catch it, it can become the #1 cause of vision loss in kids. So how do you fix it? Well, the idea is actually pretty simple. You've got to force the brain to start paying attention to that weaker eye again. The two main ways to do this are either putting a patch over the stronger eye for a few hours a day, or using special eye drops to temporarily blur the vision in that good eye. Either way, it makes the brain get back to work and strengthen its connection with the underused eye. Next, let's talk about the hips. Developmental dysplasia of the hip, or DDH, is basically when the ball and socket joint in the hip doesn't form quite right. And it's a spectrum. It can be mild, where the socket is just a little too shallow, or it can be a partial dislocation. Or, in the most severe cases, the ball is completely out of the socket. For babies with DDH, a common treatment is something called a Pavlik harness. And if your little one needs one, there are a few key things to remember. First, never, ever adjust the straps yourself. That's a job for the doctor. The harness is usually worn 24/7 at first, so yep, you'll learn how to do diaper changes with it on. You'll also need to check all their little skin folds every day for any irritation, and always put the baby to sleep on their back. Okay, time for our third section, when blood cells misfire. These are disorders that start deep inside the blood, but their effects can be felt all over the body. So, sickle cell disease, it all comes down to the shape of the red blood cells.
Healthy red blood cells are nice and round, soft, and flexible so they can squeeze through tiny blood vessels. But in sickle cell disease, they become hard, sticky, and they get this weird crescent or sickle shape. And that shape is the root of all the problems.
The best way to think about what's happening here? It's literally a traffic jam inside the body. Those hard, sticky, sickle-shaped cells can't flow smoothly. They get stuck in the tiny blood vessels and cause a blockage, like a logjam in a river. This stops oxygen from getting to where it needs to go, which causes episodes of incredible pain and, over time, can damage organs.
So when a child has one of these painful crises, managing it is kind of a four-part attack. Number 1 is aggressive pain control. Number 2 is hydration, lots of fluids, often through an IV, to help thin the blood and clear that traffic jam. Number 3, they might get oxygen if their levels are low to help stop more cells from sickling. And finally, you have to look for and treat whatever might have triggered the crisis in the first place, like an infection.
Now, this is an incredibly important clinical warning. It's about a type of kidney cancer in kids called Wilms tumor, and the instruction is crystal clear. Once the tumor is found, you do not press on or feel the child's abdomen. Why? Because the tumor is super fragile, and pushing on it could cause it to burst, spreading cancer cells through the body. It's a simple rule that can literally prevent the cancer from spreading.
And that brings us to our final section, which honestly might be the most important piece of the puzzle: supporting children and families. Because when you look at all these different conditions, the one thing they all have in common is that success depends on having an educated, proactive, and empowered family.
So what does this all boil down to for you, the caregiver? Well, first, you have to know the specific warning signs for your child's condition. Second, follow those care instructions to the letter. Third, do what you can to create a safe environment at home. And last, but definitely not least, remember that you are your child's #1 advocate. You are the most important person on their care team, bar none.
So I'll leave you with this to think about. After everything we've talked about today, from the tiniest signs of a hip issue to the urgent response for a seizure, one thing becomes incredibly clear. Early detection and an educated family aren't just helpful, they are, without a doubt, the most powerful tools we have to completely change a child's future for the better.